Thank you for choosing the Joint Replacement Program at the Cottage Center for Orthopedics. Our affiliated orthopedic surgeons are highly trained and experienced in joint replacement surgery, performing more joint replacement surgeries than any other program on the Central Coast. Our healthcare team of nurses, physical therapists, occupational therapists, and support staff will work with you to provide an informed and positive experience. Our ultimate goal is to provide you with the best healthcare possible, as demonstrated through our core values of excellence, integrity, and compassion. To help you more fully understand your hospital stay, this video highlights what you and your healthcare team will be doing for the next few days after receiving your new knee. Soon after arriving to the unit, you will be assessed for your fall risk. For your safety, we will keep the top side rails elevated on your bed, your call light within reach, and no slip footwear on your feet. A yellow bracelet may be applied to alert staff that you need assistance when you are out of bed to help prevent falls. Call your nurse for help. Do not get out of bed until assistance arrives. Vital signs and checking the blood flow in your leg will occur regularly during the first 24 hours, then as needed after that. You will have the opportunity to rest after your surgery. However, your doctor may order that you get up out of bed shortly after returning to your room with a minimum goal of marching in place for 5 steps or more. You will increase these activities the following morning, which is post-operative day 1. Your physical activities on the day of your surgery will include bearing full weight on your knee, standing at bedside, taking 5 steps in place, and possibly walking a short distance with assistance, moving with an assistive device. After returning from surgery, you will most likely start eating clear liquids until the nursing staff can see how you tolerate having something in your stomach. This usually consists of Jell-O, broth, tea, and apple juice. This is to help prevent nausea and vomiting, which is a common side effect of anesthesia. Your nurse will determine if your diet can be advanced to regular food. Due to anesthesia and pain medication, you may not be able to urinate or have a bowel movement for a day or so. You will likely have a urinary catheter in your bladder which is inserted during surgery. The catheter will be removed the first or second day after surgery, and stool softeners will be administered to help prevent constipation. New medications may include pain medications to manage pain, blood thinners or anticoagulants to prevent blood clots, antibiotics to prevent infection, medication to control nausea, intravenous fluids for hydration. You will have some degree of pain and discomfort after the surgery, so talk with your nurse about your acceptable level of pain. Your nurse will work with you to develop a pain control plan and adapt it to your needs. Here are some additional treatments you can expect to help prevent complications. Incentive spirometer for deep breathing. Take 10 breaths every hour while awake to prevent pneumonia. Pulsating stockings. Wear them while in bed to prevent blood clots. Repositioning. Frequent repositioning with assistance helps prevent bed sores. Ice and elevation to prevent swelling and decrease pain. The CPM is a machine that is designed to keep your new knee moving while you are in bed. For more information on the CPM, please ask your nurse to play our CPM video. Knee replacement interrupts the function of the muscles in your thigh and knee. These muscles will be weak and slow to respond. This means that your knee may give away when you try to stand or walk. Please get the help of a staff member before standing or walking. For your safety, we want to assist you in walking to the restroom. Call your nurse for help and do not get out of bed until assistance arrives. Your nursing team will visit frequently to monitor your pain and attend your personal needs. The first day after surgery, you will be very active. The clinical team will begin to assist you very early in the morning with your mobility. Your physical activities will include bearing full weight on your new knee, moving with an assistive device like a walker, sitting up in a chair at least twice per day, exercising and increasing the range of motion in your new knee, training with assistive devices to help you dress and undress when you go home. In addition to nausea medications and antibiotics started on the day of surgery, you will be started on blood thinners or anticoagulants to help prevent blood clots from forming. Some of the medications you will take for pain will cause constipation. Here are some things you can do to help prevent that. Drink plenty of fluids. Eat food high in fiber such as fruits and vegetables. Use a stool softener while taking pain medication. Use a laxative if you don't have a bowel movement for 2 to 3 days. Walk as much as possible. Your regular diet is usually resumed day 1 after surgery. Drink plenty of water to prevent constipation unless instructed otherwise. Your urinary catheter may also be removed today. Based on the recommendations of your healthcare team and your overall progress, your physician may decide to discharge you home on postoperative day 2. Day 2 activity will build on day 1. You will again work with physical and occupational therapy starting early in the morning. Physical therapy will begin stair training if you have stairs at home. Just 2 days after surgery, you are still at a high risk for falling. We want to help you, so please call a member of your nursing team when getting out of bed, the chair, or walking, and wait for that staff member to arrive before attempting to move. The focus of therapy will be to continue progressing in strength, walking distance, and independent self-care. Any equipment that you will need for your return to home will be delivered to your room on the morning of your discharge or directly to your home. Your case manager will ensure that this has been arranged. The timing of your discharge home will be based on your ability to meet the following goals: pain controlled by oral pain medication, urinating without difficulty, eating without nausea, ambulating 200 feet safely with an assistive device, a discharge order from your physician. We try to complete your final therapy and have you ready to go by 11 a.m., but please keep in mind that this is not always possible. While it is a goal of the joint replacement program for you to return home after leaving the hospital, the decision about whether you go home or to another care facility will be made collectively by you, your surgeon, your physical therapist, case manager, and your insurance company. The timing of a transfer to another facility, like a skilled nursing facility or rehab hospital, will be determined by your ability to make the following discharge goals: pain controlled by oral pain medication, urinating without difficulty, eating without nausea, ambulating 200 feet safely with an assistive device, the facility's ability to accept you and pick you up. Before you leave, your nurse will give you written discharge instructions, review them with you, and answer any questions you have. One of our staff will attempt to call you within a week of discharge to discuss your recovery. You will receive a survey at home regarding your hospital visit. We value your comments and hope that your hospital stay is a positive one, and that you will take the time to complete the survey and send it back. It is the hope of the entire orthopedic team that you will soon be able to enjoy a pain-free life of walking on your new knee.